More than 50 million Americans live with chronic pain. For some, it's an old injury that just never healed properly. For others, it's hormonal changes or spinal issues or issues related to diseases like diabetes. And for years, many were simply handed a prescription. Today, we're breaking down the real causes of chronic pain, what actually works to treat it, and why exercise, not medication, may be the most powerful medicine of all, as well as answer your questions here on this episode of Ask the Doc. No appointment needed.
Funding for this program is brought to you by Michael J. Zinner, MD.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your healthcare related questions and our experts answer them. My name is Dr. Kamaljit Kaur, a concierge primary care physician here in beautiful South Florida. Let's get started. Our first question today comes to us from Nash, and Nash has reached out through allhealthtv.com to ask, Hey doc, what, if anything, is the difference between pain and chronic pain? Hi, Nash, and thank you for sending in your question, a very important one at that. And just like with most things in life, it's good to define what you're experiencing because then that may also change how you go about managing it and your response to it, how you feel about it. Now, pain in general is your body's response to an irritating stimulus. That could be something like a hot stove or something that's a very, very high temperature or something that's a very, very cold temperature. It could be something like a needle prick. Say a needle accidentally hits you in the finger or other parts of your body and goes through skin. That's going to induce pain. It could also be something a little bit more complicated, like a sprained ankle or a broken bone. Any one of these is an example of a stimulus that's irritated the normal baseline of your body and physiology, and it's going to respond in a painful way. And that pain usually goes away whenever that stimulus goes away. So, depending on how long you've had your hand on that hot stove, if you take your hand off, chances are that that pain is going to go away. That's considering hopefully you haven't burned yourself too bad. Same thing with the needle prick. Once the needle's taken away, that pain sensation generally goes away. Now, when it comes to the types of pain, chronic pain, which is a focus of our discussion today, is a little bit different. The inciting events are usually the same. However, chronic pain happens when that sensation or that irritation in your body does not go away even after the stimulus is taken away. So, say you do put your hand on that burning or hot stove and you happen to sustain second or even third degree burns. Those burns are probably going to last longer than the couple seconds after you take your hand away from the stove. Depending on how bad you have burned and how bad the inflammation is that's resulting from that, you may have pain for a couple weeks while your skin heals. Sometimes, if the burns are really bad and the nerves in that area get really damaged, you may have pain for months or even years. Now, whenever you have pain that lasts more than 3 months after the inciting event, that's generally termed chronic pain. And this can really negatively impact one's life. It can impact your ability to live day to day, do your normal activities. For instance, if you had your hand on that hot stove, you sustained a burn, and now you have chronic pain that's lasted 3 months out, you may not be able to do normal activities with your hand like you were able to do before. Something as simple as holding something that's heavy or even manipulating your hand in certain directions. Because if that burn has really left a significant scar tissue, you may not be able to move your hands like you were before the burn. I'd also like to point out one of the most common misconceptions when it comes to chronic pain, the fact that it can't be healed. And that's not always true. And I say that because, well, I'm undergoing some pain myself with some lower back issues that I've had. And it's been almost 2.5 months that I've been going through this. And one of the biggest things that I see my patients who have chronic pain and that I found myself feeling is, oh my God, this is never going to go away. But that's not true. A lot of times, if you address chronic pain early on or pain in general early on, then you can implement certain techniques that we'll talk about later in the discussion that can help you heal and then resolve that pain as well. So that's the one thing I want to make really prominent is that just because you have pain and it's lasted long doesn't mean it's going to necessarily be there forever. You always want to get it looked at so you can get it treated and healed appropriately too. Now, pain that should have gone away in a timely manner with appropriate treatment and fails to go away really is a common thing that I see in a lot of patients, and most commonly that happens because it wasn't treated appropriately right off the bat or even, a couple days or a couple weeks into it. So, like I said, if you're experiencing pain, you want to get it checked out and so it can get treated and you can heal appropriately. Let's move on to our next question. This one comes to us from Sydney, and Sydney asks, "Hi, Dr. K. I was diagnosed with diabetes last year. I knew something was up because I was always thirsty. Now I'm starting to feel a burning sensation all the time in my feet, and I'd like to know if this was related to the diabetes diagnosis." Hi, Sydney. Thank you for sending in your question. And I'm sorry you're going through this. I know that that can be a quite irritating sensation, especially when you're not sure why it's happening to begin with. And absolutely, neuropathic pain is one of the most common complications of diabetes, especially when the diabetes is not being treated appropriately and you're in a constant state of elevated blood glucose or blood sugar levels. This happens primarily because excess sugar in the bloodstream is very damaging to your peripheral nerves. Peripheral simply means nerves that are outside of your spinal nerves. So nerves that are in your arms, your hands, your feet, your toes. Those are called peripheral nerves. And like I mentioned, high blood sugar levels on a constant level are very, very damaging to those. While it can sound scary, sometimes neuropathic pain can be improved or even reversed if diabetes is tightly and well controlled. So, even if you're experiencing it now and it hasn't, especially if it hasn't been that long, if you work to get your diabetes under control and you work to get your A1C under, especially under 7, you're going to see that pain resolve and hopefully even go away. It may not happen overnight, it may take some time, but it is possible that it can happen. Let's talk about a couple other top causes of chronic pain that I think are important to know about. So, musculoskeletal issues, we see this all the time. And like I mentioned, this is something I'm suffering myself. Lower back pain, broken bones, years later that produce pain, ankle sprains, anything like that can take a long time to heal, especially back or neck issues, because these are muscles and part of your musculoskeletal system that we use a lot. So it takes longer to heal, but it can if you do the right things to support it. Arthritis and inflammation, especially in the joints, this is something that can result in chronic pain as well. And unfortunately, we see that all too often. Neuropathic pain, just like we were just talking about with the diabetes, nerve damage can certainly cause chronic pain. Past trauma or surgery. It's unfortunate, but sometimes there are surgical complications after a procedure that can result in a nerve being nicked, maybe accidentally during surgery, and then that can produce long term pain. Trauma, if you happen to, heaven forbid, get into a car accident and certain extent of damage is lasting and doesn't heal appropriately, that can result in chronic pain as well. Headache disorders. There are many people who I know suffer from migraines and cluster headaches and different types of headaches. Even though they may not be occurring for 3 months straight, the fact that they happen frequently can certainly still fall into that chronic pain umbrella of terms. And then there's cancer related pain, which is probably one of the most difficult types of pain to manage, to deal with, and to treat. But it is something, unfortunately, that we're seeing increasingly as well. There's more causes out there, but these are the most common ones that I see in clinical practice and that people do tend to suffer with. But as I mentioned, anytime you're feeling any of this, the first thing you want to do is not ignore it, get it checked out because there are treatments available, whether they're medication or not. There are ways to help make you feel a little bit better and hopefully make the pain go away altogether. All right, let's get to our next question. And this comes to us from Rosalie asking, Hello, Dr. Kaur. With movement being prescribed as part of chronic pain management, could you elaborate on what types of exercises and physical therapy approaches this includes? Hi, Rosalie. Thank you for this wonderful question. It is a great piggyback on what I've been talking about already because exercise, I mean, we've all heard it, move it or lose it, right? And I say that probably 10 times a day to my patients and to myself, to be honest with you. Now, this can really depend on exactly what type of pain you're having and what is causing it. Generally, any movement that's not going to exacerbate what you're already feeling and the pain that you're already having is going to be helpful and is going to be recommended. How intense you should be engaging in certain exercises and therapies, that is really, really going to depend on what's going on overall and what's happening inside your body and what level of endurance you can start off with and where you should be. I know it's not a clear-cut answer, but it's an answer that's really gonna need the involvement of your physician, whether that's your primary care physician or your orthopedic surgeon or your neurosurgeon or neurologist, and your physical therapist. Sometimes it's even a good idea to get evaluation from what's called an exercise physiologist. They have a little bit more training or a lot more training when it comes to the body's internal mechanisms and responses to exercise for different types of people and different ages of people. So a little bit more knowledge than, say, a personal trainer or a fitness trainer would have. So it's always good to compile this team and really know what's best for you because the number one thing is even though we want you to move and we want you to stay active, we don't want you to hurt yourself. There's no benefit in going from 0 to 100 just because we think that movement is great. On the other hand, I also want to make a very, very important note, especially when it comes to a lot of musculoskeletal types of pain, arthritis, lupus related pain, and even cancer related pain. One of the worst things that you could probably do is not move at all. So I know sometimes when you have pain, for instance, I have back pain right now, and I feel like I can't do certain movements because that's going to make my pain get worse. But it's actually quite the opposite. Doing certain physical therapy exercises that my doctor has recommended is actually probably the only time that I don't feel like I'm in pain. So movement definitely helps. The longer I don't move, or the more you have bed rest, or you're sitting in a chair all day, that's actually going to be worse because that's going to make a lot of those body parts stiffen up. And then they're not going to want to move at all. And when you try to move them, that's what's going to provoke that underlying pain and inflammation. So, just like we want you to move, we definitely don't want you to not move at all. But there is a huge, huge gray area on what exactly you should be doing. And, like I said, make sure you talk to your doctor because you always want to be safe about it. All right. Well, in case you missed it the first time, here's how you can continue to send us your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
So we received another question from Instagram, and this one comes to us from Genevieve. Genevieve is asking, Hi, Dr. Kaur. My brother has been experiencing significant nerve pain in his arms and legs. After undergoing testing, he was diagnosed with neuralgia related to his MS, multiple sclerosis. I'm familiar with what MS is, but could you please explain what neuralgia is and how it relates to his condition? Thank you for sending in your question, Genevieve, and I'm really sorry to hear what your brother is going through. I know that MS related pain, just as I mentioned earlier with cancer related pain, can be one of the most difficult ones to grasp and manage. I hope he's getting the treatment that he needs and he can be resolved or healed from that pain. Now, talking a little bit about how MS contributes to neuralgia and what neuralgia is in general, well, let's start with the fact that multiple sclerosis or MS is a disease that affects the brain and spinal cord. In MS, essentially the body's immune system mounts a response, an unregulated response that results in a lot of inflammation and it attacks that protective sheath around your nerves. Now, this protective sheath is called myelin. Usually, and one of the most important jobs that myelin has is to send messages from one nerve or signals from one nerve to the other so your body can do what it does. You can move, you can see, you can talk, smell, pretty much every action that you take on a daily basis. When this protective sheath or myelin is damaged, it's called demyelination. Basically, the nerves aren't going to signal the right way. They may misfire, they may not fire at all, they may be really overly sensitive, and then that can result in pain. This can really hurt those sensory pathways and the nerves, especially the ones that carry feelings like touch, temperature, and pain from the body to the brain. Those are very commonly affected, and then that's what can result in the type of symptoms that we see, with our MS related pain patients. And because of this damage, the nerves send the wrong signal even when there's no injury. So you might experience pain even though you didn't do anything to incite it. You didn't put your hand on a hot stove or get pricked by a needle, but all of a sudden you're feeling those sensations. And that's because the misfiring that's happening due to that damaged myelin sheath. Now, the damaged nerves can also become really, really sensitive. So you might feel super cold when it's really not cold in the area or in the room that you're in. So, as you can see, it's a whole mishmash of things going wrong with nerves just because of the damage and inflammation that's been done to the nerves. And because of this, people can experience chronic neuralgia. Neuralgia is the vague term for nerve related pain. And then this can certainly happen with MS patients as well. This can also result in stabbing type sensations, burning sensations, or even electrical shocks that you might feel here, there, and everywhere. I'm again really sorry to hear that your brother is going through this, and I hope he gets the management that he needs so he can get back to feeling a little bit like his old, healthy self. Let's get to the next question. This one comes to us from Facebook, and it's from Ilian, and Ilian is asking, Hola, Dr. Kaur. I've suffered from chronic pain my whole life and remember only too well taking opioids. I never got hooked, thankfully, but I understand how it could happen. Why were they so commonly prescribed back in the day? Hi, Ilian. Thank you for sending in this question. This is one of those that we don't really talk about too often, but we probably should because we have a huge population of patients who suffer from chronic pain. And these are patients who are probably old enough to remember when they used to go to their primary care physician or their doctor's office and say, Hey, I've had so and so pain for 3 months. And the doctor would just say, Okay, here's a prescription for oxycodone or Vicodin or hydroco, a myriad of the ones that were available and still are available, but were more easily given out back in the day. And unfortunately, there are reasons for that. There's a lot of reasons for it, and it's actually quite complicated. Now, these medications became frequently prescribed more so in the early to late 1990s and early 2000s. This was due to a combination of them being one, easily available. Manufacturers were making them in large quantities, so they were readily available to be prescribed. There wasn't that much scrutiny around them when it came to DEA regulations and honestly, even research. So they were taunted to be, or they were promoted to be kind of like this magic pill that, hey, if your patient has pain and you want to make them feel better and feel like their normal self again, prescribe them this opioid analgesic or painkiller, and it's safe. We don't have any issues with it, go ahead and prescribe it. And honestly, that's kind of what was happening. Unfortunately, there was a lot of marketing done by pharmaceutical companies to that effect. So we were under the misconception that these were safe medications and they were just going to help our patients feel better, which is what we're trying to do at the end of the day. Unfortunately, they were not the magic pill that we once thought they were. And around 2012, this started to change, and it changed drastically in March of 2016 when the CDC released formal guidelines that aimed to find safer alternatives, number one, and to limit prescribing. So, whereas before a physician could send a prescription for oxycodone, 30 tablets, 60 tablets, 90 tablets, that was significantly changed. And today it's very limited. In fact, for non cancer related pain, we're not really even supposed to be giving more than just a few days of prescription without a valid reason. And the scrutiny, the DEA regulations, everything is so much more tighter. And I know that sounds drastic, but it really needed to be done because, as we've learned, these medications are not safe when given on a regular basis. As you alluded to in your question, there's addiction risks with it. There's risks of respiratory depression, neurological depression. There's a whole list of stuff. Of course, there are times when these medications are needed. And for instance, right after surgery, right after a major surgery, They may be prescribed, they may be given to you in the hospital and then prescribed for a few days at home as well. In fact, even for wisdom tooth removal, they're still offered to patients. I am pleased to see that a lot of my patients actually just deny them for non serious surgeries or interventions. And they say, you know what, I'll just take some Tylenol or a safer alternative. Or sometimes I'm surprised that patients will tell me I'll bear through their pain instead of taking these opioids. Because, like I mentioned, now we know that they're not as safe, but also when you take them, sometimes you do feel worse than the pain actually makes you feel. So it is changing. It's changed for the better, I feel, and we do have better options. There's other ways now to treat pain. If you do find yourself in a position where a physician is prescribing you an opioid or narcotic painkiller like Vicodin, oxycodone, Dilaudid, you always want to ask, what exactly is this? Why are you suggesting this for me? How is this going to help me? How long do you anticipate that I'm going to be on it? And what are the risks to taking this? Benefits versus risks, always. And you want to make sure that the physician and you are on the same page about that and you are either comfortable or not proceeding with taking that medication. And honestly, that goes for any medication, but yes, especially the narcotic and opioid painkillers. Thank you for that question. Let's move on. The next one is from Mara, and she reaches out through Instagram asking, Hi, doctor. I'm studying to be a nurse practitioner, and I'd like to know why chronic pain often comes with anxiety or depression. This is a fabulous question because this is very, very underrated. The relationship between physical pain and mental health. We have become a lot more cognizant and aware of this relationship in the last 1 to 2 decades, but it's still not something that people think about. Now, many people may not relate their chronic pain to anxiety or depression, but there is a strong connection. Think about it. When you have a simple cold, like I had last week, and you're out for a day or two or a couple days and you can't do the normal things that you're used to doing. You can't go to work, you can't cook for yourself. Heck, sometimes you don't even want to get off the couch. That is quite limiting, number one, but it also mentally affects you. You start to get annoyed. In the beginning, you're probably going to get angry and annoyed. And sometimes even at your own body, you might feel like your body is betraying you. Hey, I'm supposed to be healthy. Why are you doing this to me? So that annoyance with just a little cold. Now imagine somebody with chronic pain, somebody who suffered from some type of joint pain, bone pain, or headaches for 3 or more months, sometimes for even years. That certainly starts to affect their mental health because that little bit of annoyance may definitely turn into depression and or anxiety because now they're living with something that's limiting them from living their best life and to the full potential of their health. It's very common for someone who is in chronic pain to also have anxiety and or depression. In fact, about 40% of individuals with chronic pain also actually have depression or anxiety formally diagnosed. On the other hand, it's also been seen that individuals with depression and or anxiety may actually incite pain in their body. So it's a bidirectional relationship. It goes both ways. And why does this happen? Well, chronic pain and mental health disorders like depression and anxiety affect some of the same areas in your brain. The brain areas that control pain, mood, and emotions are so closely intertwined that when one is affected, the other is surely affected, especially if this is something that's long term. So, when someone has long term pain, it can definitely incite mental health conditions like depression and or anxiety. It definitely increases the risk of that developing as well. This is why, as physicians, whenever we have somebody who has chronic pain, one of the first things that we ask them and talk to them about is how are you doing? How are you managing? How are you dealing with this and who is supporting you through it because it's very important to have a support system in your journey of healing from any disease, but definitely from chronic pain as well. I hope I hope that helped answer your question and highlight a little bit about the relationship between physical and mental health. Now, these are great questions and if you got questions for us, here's how you can send them in.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Our next question comes to us through allhealthtv.com and it's written by Otto. And Otto asks, Hello, Dr. Kaur. What are other non opioid painkillers that are now being prescribed for chronic pain? This is great. And this is something that I like to tell everybody about because it's not just narcotic and opioid painkillers that we give out anymore. There's a lot of other modalities to treat chronic pain. And in fact, most of the major medical societies and the CDC recommend that we go through these modalities first before we even talk about actual medications or putting anything in our mouth or injecting anything to treat that chronic pain. Some of these are exercise and physical therapy, weight loss, which can certainly help when it comes to joint pains, stress reduction through therapy, laser therapy for some conditions, yoga, acupuncture, massage. In different ways, these have been shown to treat chronic pain very adequately if done appropriately and depending on how bad the pathology is that's causing the chronic pain. Now, as far as non-opioid medications go, we have non-steroid medications like ibuprofen, we have Tylenol, we have corticosteroids, and then we have topical lidocaine as well. So there are definitely other modalities. As you can see, chronic pain is a very significant occurrence in many people, but there are ways to treat it. You always want to talk to your doctor, make sure that you know what's exactly going on so you can get healthy and you can get back to living your best life. I want to thank you again for sending in these questions. It's been a pleasure answering them and giving you some knowledge. I hope you all stay well and move it or lose it. Don't forget. We'll see you here next time on Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Funding for this program was brought to you by Michael J. Zinner, MD,